First, we're taking your calls on whether newly qualified doctors should strike over jobs. 020 7862 2222 is the number. So we're resident doctors we're talking about, or junior doctors to use the old term, in their first year of work after medical school. 97% of those who voted in a recent ballot have backed potential strike action over job insecurity. The British Medical Association said this year there were 10,000 speciality training jobs available for 30,000 candidates. No strikes are planned, but it's piled more pressure on the government, who are also trying to resolve a separate dispute about pay. You may remember resident doctors walked out for 5 days in July after demanding a 29% pay rise. So this all adds to it. Let's just have a look at what we're talking about. If you take a group of young doctors here, you guarantee that as they work on their projects with their test tubes and blood tests and whatnot, they're thinking about the pathway to actually getting a job, a proper job as a doctor. NHS training pathway starts at medical school, 4 to 6 years of medical school, then 2 years here, the foundation years 1 and 2. So you're going to add 2 years to that. If you're going to become a GP, you then go that way into the GP training program, which is 3 years. So you could be at 6, 8, nearly 10 years. Speciality training, well, that's 5 to 7 years more. So you're looking at really more than a decade. So it's not so much of the young doctor here, is it? By the time they all get to see a patient, they're quite old doctors. They're actually aging before our eyes. It takes so long. And by the way, the other thing is that, never mind the fact it takes so long, the jobs aren't there. Mary, that seems incredible. We need doctors and there aren't the jobs for them.
Yeah, which is dreadful, and we need to make it possible for there to be jobs for them. The government's making that very difficult. There's insufficient funding, and also they're filling up the medical schools with students, and there aren't enough jobs for them at the end of it.
And they're paying a lot of money, these students.
They
to
pay
train.
a hell of a lot of money.
Because it's not just a 3-4 year course, it's 6 years.
No, and they work very, very, very hard. I mean, there's a really horrifying statistic, which is that this year more than 10,000 doctors applied to become psychiatrists, and there were only 500 able to get a place. 500. And when you think how many psychiatrists we need, and when you think how many other specialty doctors we need, and this is not just in psychiatry, it's across the board.
So 10,000 people trained to be psychiatrists for 500 jobs. Something is it may be their fault, Mike, that they shouldn't be training.
Look,
I don't know.
No.
Wes Streeting was supposed to be a breath of fresh air coming in to reorganise the national... I mean, it's an absolute mess. We've got tens of thousands of unemployed doctors in this country. We've got more doctors coming from abroad and taking the few jobs that are here. When is Wes Streeting going to get this sorted? But my main point here is that the BMA, once again, to me, are appearing like a bullying left-wing trade union. That's what they are, right? Train drivers are accused of being bullying left-wing trade union. The BMA doctors' tactics are exactly the same. I mean, they've got 22%, not happy with that. They've come back for 29%. And now, on the back of the complete inefficiency of the National Health Service, they've decided to pick on another issue and start talking about striking again. I wish they'd just start treating patients and stop being political.
I can't remember a strike ever before in my lifetime where people are striking for there to be more jobs in their sector. That's an unusual strike, isn't it? I'm not saying it's not justified, I'm just trying to get my head around it.
Well, I think what they're saying is if you're going to train all of us, we're assuming if we're going to give 10, 12, 13 years of our lives, you know, to train to be a specialty doctor, or 10 years to become a GP, we're kind of expecting a job at the end of it.
But the people striking either have jobs, in which case they don't have a problem, or they don't have jobs, in which case they're not striking. You can't strike if you've got no job.
Well, if you're an FY2 doctor, you can strike because you're on the wards doing your...
So you're in the training pathway, you're in the hospital.
You're in the hospital.
Right, I see. Sorry, okay, I've got it.
But shouldn't the responsible body of doctors should get together with the NHS, should get together with Wes Streeting and say,
trying to.
No, they're not doing it, though, are they? What they're doing is they're saying we'll go on strike instead. What I'm saying is, can't they first use their skills to get together with Wes Streeting and say we've got to sort out the National Health Service instead of rushing to the barricades again? We're going on strike.
Mike, isn't the answer to this? The NHS, if it's going to look after 68.5 million people, is going to need more money.
No, it needs less money and more efficiency. It is the most inefficient body in the whole of the world. It employs more people only than the Red Army in China.
And the Indian Railways.
And the Indian Railways, and yet productivity is absolutely minimal. Productivity is 10 or 12% down in the public sector since before COVID.
In the public sector, but in the NHS, the productivity is not down. In the NHS, productivity is very high. The problem is too much money has gone into management.
I totally agree. Too many middle managers.
Is that right? I mean,
it's absolutely right.
Pushers.
I know this because I've read the report, but the name will come to me in a minute. But
Louise Casey usually, but I don't know.
No, it's not Louise Casey. It's
Oh, I know. Yeah.
Anyway, but the point is that's the problem, and you can't. Also, if you're going to have doctors looking after us, it's the first rule: look after your doctors, look after your nurses, look after everyone who's.
But look after your patients. I think the NHS.
But you can't look after them if you're exhausted and make poor decisions.
The BMA,
which is an important thing.
BMA, in my view, have more interest in looking after their people, those are the doctors, than they do looking after the patients.
But they're not a patients' union. That's the whole point of a trade union, Mike.
Yeah, but the whole point of a trade union is also to make sure that you look after the customers or the people who you serve.
I don't know about that. If you were in a trade union, they say we're interested in your viewers. You'd say, no, I want you to be interested in me.
I think their priorities are all wrong in the BMA. They will look for a reason to strike on anything. I mean, alongside this, they've got another pay demand coming in now. It's outrageous.
But we have a moral duty to doctors too, to make sure that they can work in fair, safe conditions, that they're not working hours that are crazy, that there are jobs for them when they're
and they have a duty of care to their patients. We know from the official facts that at least 5 people died in the last doctor's strike because of the unavailability of a striking doctor. So do they really care for the patients?
Let's go to Joe in Cornwall. What do you think of this latest strike action, Joe, over the lack of jobs for doctors?
Well, I'm all in favour of them striking because I used to be a radiographer for 10 years, including training, and we protested once. I mean, think of all the training they have, the long hours, etc., etc. They're entitled to earn a decent wage, and people, if they don't get that, they go privately or they go abroad.
Yeah, well, radiography is a very interesting one, Joe, because you will have seen the reports that say that when you put a radiograph in front of AI, it will spot the tumour quicker than a human.
I didn't know that, but I can believe it.
Well, then, in that case, what's to stop them just rolling out AI across the NHS?
Well, I don't know the answer to that, I'm afraid.
As you say, Mary, lots of things, because they won't have the bedside manner that Joe's got, for a start.
Absolutely. And Joe, it's great to hear from you, and I thank you for what you've done, seriously, in your work in the NHS. But, you need human beings. You need human beings there to diagnose, and, it's not just about, for example, GP phone calls. My father was a general practitioner. He would have been absolutely horrified. He said, because sometimes people come in with one thing and then you just spot something and you think, I'm not happy about this, and you ask more questions. Many diagnoses come about because of face-to-face contact, because of doctors in the past having, there was a doctor-patient relationship that was durable. The NHS is suffering a great deal from the lack of continuity of care.
It'd be nice to have a doctor who you saw every time. Those days have long gone. By the way, the 5 deaths you mentioned were 2023, 2024 strikes, just for the record. Yeah. Thank you, Joe. Richard in Berkshire, hi.
Yeah, morning, Jeremy. Morning, panel. I had an appointment 2 weeks ago with a doctor in a local clinic. She'd recently qualified, and she was doing the rounds in the clinics in the different areas. And she was saying she wanted to specialise in oncology. She had, according to her, 70 people she had to compete with to get a specialist place in oncology within the hospitals.
Yeah, I bet.
So, clearly the position is that it's not that we don't have enough doctors. We have enough doctors coming through the system, through the training system. We just don't have the doctors to fill. And as she said, she's desperate to get into oncology. She's going to have to compete with 70 others. Did a fantastic job with me, so I think she's going to be absolutely fine competing, but that's not the point. So they're coming through the system, but the positions are not being made available for these doctors to fill, which then makes the whole idea of other doctors that have jobs going on strike to get more money absolutely ludicrous. When we've actually got supply and demand, we've got more demand than we've got supply.
Well, it's an unusual one, isn't it? 'Cause usually you'd think we've got we've got vacancies and no one's skilled. That's the classic story of our economy right now. We haven't got people to fill jobs. This is the other way round.
Of course it is. We've got too
It's
many
so
skilled
weird.
people and we haven't got enough jobs for them. It's ridiculous. 40%, I read, of doctors who qualify do not end up practicing medicine because there's no opportunity for them to do so.
OK, Richard, thank you. After the break, we'll take more calls on this. Should new doctors strike over jobs? So we're asking if shops should be allowed to stay open later on Sundays. Now, calls on whether first-year doctors should strike over the lack of speciality jobs, because we're showing in our graphic, you could have a 10-year pathway to qualification. It's a really, really long grind to get skilled up, and then there's no job. Steve is in Gloucestershire. What do you think, Steve?
Yes, hi Jeremy. I'm actually seeing you in a fortnight in Cheltenham, so I'm looking forward to that.
Oh, great.
But regarding this, yes, I actually worked for a couple of years in the NHS at Gloucester Royal Hospital as a healthcare assistant. It's just not doctors as well. It's the amount of nurses that don't get jobs as well as doctors. I think the system's just broken, really, for the amount of people that get qualified and obviously motivated to obviously get a job within nursing or doctoring.
Yeah.
And the jobs aren't available. They end up working at your local Starbucks or something.
Well, it's bizarre. And I suppose the thing is that the training colleges don't have any responsibility to look at the number of outlets. So it's a bit like media studies.
Yeah.
People being trained by the thousand in
Absolutely.
media studies. There are no jobs in journalism anymore.
Yeah.
But so, maybe is it down to the people who want to be doctors to take a proper view of the professional landscape, Steve, and to say, well, there's no point because there are no jobs?
I know the amount of people that I've helped on the wards train and obviously get their skill in certain areas of health. I've worked as a healthcare assistant on the respiratory wards. The amount of training nurses and doctors that go through the system, and at the end of it, they're actually come to me and said, I'm applying for 15, 20 jobs, and, I know they know people that just don't get the jobs at the end of the day.
Well, thank you, Steve. Thank you. But it may be we've got enough doctors in the NHS now. Well, that's it. We're done.
I'd like to know from Steve, because he worked in a hospital. Mary, you made the point about too many pen pushers. Are people aware of that when they're in hospitals? There's lots of administrators, lots of pen pushers, not enough doctors.
Steve, is it lots of pen pushers when you worked in the hospital?
There certainly are. There certainly are a lot of pen pushers at the end of the day, and it's just top heavy.
Yeah. Well, thank you, Steve. Yeah. We've got our pathway thing. Oh, is it? I thought it was here. Yeah. Okay. This is just remind ourselves, because I can't believe this. You could spend 6 years at medical school. You then go into a sort of posting. That's 2 years. So you're then at 8 years. You might then end up with 3 more years GP training. Although that would overlap with foundation year 2, I guess. So that's 4. It could be a decade. OK.
A mate of mine's daughter is a GP now, and it took her 7 years. She went to King's College London. So it is a long time.
So she got a job?
She got a job, yeah.
OK.
Yeah.
But so there are no jobs. Why are we training people? Is that not... Maybe no one's leaving. Maybe we've got steady state now.
No, I think they've reduced the number of opportunities. That's the point.
I think the numbers of opportunities have been reduced. Too much money has gone into management. Too much money has been wasted.
Totally agree.
In that sense. And there is a need for more doctors. Yeah. There is a need for more nurses. The clinicians of all kinds are running ragged, and we have increasing needs.
And if you look at
a huge population.
Let's get this back on the board. So OK, let me just show you again. So 5 doctors applying for every GP training post there, and there's no overlap there. So that's 1 year, 2 years, then another 3. So that's 5 years. Once you get trained, it's 5. It blows your mind. Once you've done your studies, you can do another 5 years, and then you don't get a job. Let's see. Chris in Merseyside, what do we think of this?
Well, good morning, Jeremy. Good morning, panel. My daughter is in Foundation 2 at the moment. So she's done her 5 years medical school. She's done Foundation 1, and she's now in Foundation 2.
And then what? And then what, Chris?
What to apply for in terms of which speciality she wants to go into. So she absolutely is feeling the pressure of not enough jobs and the number of people that are applying for every speciality that is out there. So I feel very strongly that for her, she should have an opportunity to get a job that she's been training for.
Yeah.
And let's remember, I think most people go into medicine because it's a vocation. It's something they're passionate about. It's not just like a job for them. It's
Well,
that they
but
care
hang
for
on a minute.
people.
You could say the same of people who become plumbers and electricians and broadcasters. There's nothing that remarkable about feeling called, is there?
Well, no, but
hopefully we all
I
do.
think-
There's a human element to it, isn't there? You know, the compassion of
Yeah.
life and all that.
Yeah. Okay.
There's an empathy that you want from a doctor that you don't need empathy from a plumber if you've got a leaky tap.
Fair point.
But
yeah.
my point would be, though, that I don't feel like new doctors should strike because of the patient impact. And every delay in an operation timing could have potentially, dangerous
Okay. Understood.
implications.
Thank you, Chris. One of the things, Chris, that's come up is this issue of they've got 10,000 people who've graduated as psychiatrists and they've only got, what is it?
500.
500 jobs.
500.
So your daughter's got to think about where are the openings.
And people do.
And so, Chris, if she's thinking like that, where does she go?
So she has to apply for not just hospitals in her area, but hospitals across the country, which could have an impact on that. But I think fundamentally it's within the government's gift, because they are in charge of the NHS, to match up the number of training places to the number of jobs that they're looking for.
Totally.
They know they've got succession planning. Most businesses do this. And it's not beyond abilities just to match that up. Yeah. They know who's retiring in 7 years' time. They know who's going to be rolling off, so to speak. So match the places that the start of the training.
Yeah, good point, Mary.
Also, yes, I was just going to say, Chris, that your daughter's done her training. Perhaps your daughter is doing what other young doctors are doing now, which is perhaps applying for specialties that are not her first, second, or even third choice because there are more openings in them.
That was my point, yeah. I mean, I gather that most of them want to become dermatologists because the private thing is just going, with dermatologists, going gangbusters because everyone's got a skin complaint. Ellie in Liverpool, hi.
Hi.
How are you doing, Ellie?
I'm fine, thank you.
Are you training as a doctor?
So now I work in a training hospital as a clinical support worker in a very specialised area.
Oh, what sort of area is that then?
So it's gastroenterology, but it's endoscopy as well.
So you're doing colonoscopies and all that, yeah?
Oh, much more than that. Definitely much more than that.
Okay, I won't even think about it. But what do you think about the strike plans?
I do believe that they should strike. I do believe that everyone in the NHS is entitled to strike. But my reason for phoning is the comment that the man made, I don't know his name, about the 5 people that died within the strike days. Well, I was actually a patient on one of the strike days due to a serious ectopic rupture.
Okay.
And my life was saved on that strike day by not just one doctor, but a village of doctors.
All right, well, I'm glad they were there for you. That's great.
Of course,
Thank
and
you,
they're
Ellie.
all from different areas and specialties. And it takes a village, not just one doctor, to care for the patient.
All right, thanks for all your calls on this. Later we'll be asking if shops should be allowed to stay open longer on Sundays. First, after the break, we want your calls on whether we should stop paying benefits for some mental health claims. The Tories say they would stop claims for things like anxiety, depression and ADHD. Do you think that's fair? 0207 862 2222.